This presentation is being recorded, so please be aware of that and let us know if you disagree. No, good. So the presentation on the MSc Reproductive Genetics and Fetal Medicine. I am Pascale Guillot. I'm the program director of the MSc, and we also have with us today Dr. Buckley, who is going to introduce herself.
Hi everyone, I'm one of the co-directors of the education for the Institute for Women's Health. So if we have any questions wider about the Institute, then I can help answer that later on.
And Alison, would you like to introduce yourself?
Yes, hi, good morning or good afternoon. My name is Alison and I work in the Faculty of Population Health Sciences, and the Institute for Women's Health sits under the faculty, one of 8 institutes at UCL.
Good, thank you very much. So here we go. So I will start by introducing a little bit UCL and mention just a few key points. So UCL was founded on the belief that education should be available to all and everybody who could benefit from it. And that's an idea that was very much unheard of when it started in 1826. UCL was the first university in England to accept women students on equal terms with men, and the first in England to disregard social and religious background. UCL operates a unique connected curriculum, making connections between researchers and students and enabling students to undertake research activity of their own, generating original outputs and knowledge. I'm sure you know UCL is one of the top universities in the world. We are consistently placed in the global top 20 in a wide range of world ratings. And this year we are rank 8, I believe, making it the top ranked institution in London and 3rd in the United Kingdom, 4th in Europe. More than 13,000 staff and 42,000 students from 150 different countries. We operate in a global context. We are committed to excellence, innovation, and the promotion of global understanding in all its activities, whether that's being research, teaching, learning, enterprise, or community engagement. UCL is a global university. Our alumni community has over 250,000 members in 190 countries worldwide. As you've just seen, UCL is a very big organization, which might seem hard to get grips first. It's broken in 4 schools. One of which is the School of Life and Medical Sciences, or SLIMS for short. And within SLIMS, there are 4 faculties: the Faculty of Brain Sciences, the Faculty of Life Sciences, Faculty of Medical Sciences, and the Faculty of Population Health Sciences. Our faculty, our institution for women's health, is in the Faculty of Population Health Sciences. The Institution for Women's Health is itself split in 4 research departments. We have reproductive health, women's cancer, neonatology, and maternal and fetal medicine. So that gives you an idea of the wide range of research area we are undertaking, and this involves, sexual and reproductive health, to gene transfer technology in the fetus, prenatal cell therapy, women's cancer, neuroprotection in preterm babies. So here you can look and read the Institute for Women's Health report that we wrote in 2019. So the education at Women's Health. So we have the MSc of Reproductive Genetics and Fetal Medicine. Shouldn't read prenatal, but let me turn out. Reproductive. We also have an MSc of Reproductive Science and Women's Health, an MSc of Women's Health, an IBC in Women's Health, and we have, of course, MPhil, PhD, and MRes. So when you join, you will have a chance to interact with the students from the other courses, and you will also share some of the modules with them. Some of the modules run since 1996, so we have quite a lot of experience in teaching these modules. So the structure of the MSc, you will first start with an introduction week and project weeks that will introduce you to UCL, to the Institute, some key staff at the Institute, and to each other. During this week, we talk also about the key skills you're going to learn. You will have sessions about presenting, writing, networking. So all this during the introduction and then project and skills week. Then you will have 8 taught modules. Each module runs over 3 weeks. And depending on the module, there is usually between 2 and 4 days of face-to-face teaching. The Wednesday is usually devoted to reading, and you don't have any lectures. And you have, once you have your 8 taught modules, then started in June until September, you will have your research project going on. So this introduction weeks and modules and research project lasts for a full year. It's really September to September teaching. If you are full-time, if you are part-time, you can do it over 2 years. And if you are modular, you can do it over 5 years. You will have career sessions about first an introduction, about research degrees, about clinical embryology, genetics, clinical careers, social, political careers, or other careers that may be interesting for you. So that's the 8 modules I was talking about. So you have basic genetics and technology, the first one. And in this one, you will learn about meiosis, aneuploidy, mutations, linkage, bioinformatics. So again, it runs for 3 weeks. You have an assessment, and then you start your second module, which is fertility, infertility, science and society. In this module, you will learn about oogenesis, spermatogenesis, infertility, and art over 3 weeks. You will then move on genetic mechanisms. There you will have lectures about the normal processes in cells, genetic basis of disease, detection of different abnormalities. 3 weeks. You will then have your medical genetics module, where you will learn about phenotypes, diagnosis of genetic disorders, and clinical management. You then move on to prenatal diagnosis and screening module, where you learn about the normal fetal scanning, anomaly scanning, and invasive and non-invasive prenatal diagnostic. You then have the organogenesis and fetal development module, learning about normal organ development, abnormalities, and imaging. The next module is the fetal and perinatal medicine one, where you have lectures on complex clinical management, some case reports, interventions, and neonatology. And the last module out of the 8 is the pre-implantation genetic diagnosis and development technologies, where you have lectures on PGT and stem cells and genome editing. The assessment can be critical review, a written report, or essays. You will have case reviews, book reviews, or presentations as well. At the end of your 8 modules, you will have projects. We offer different types of research projects. It could be a laboratory-based project where you will do experiments in a host lab, but it could also be a narrative or comprehensive review. It could be clinical or applied health research. You could also do an analysis of pre-existing data. And finally, you could have questionnaires or surveys, focus groups, or interviews. So we offer these different types of project, and you will choose one type and a host, a supervisor, to do this project. At the end of your 8 modules, it starts around June, and the project runs until September. So a few words about our students. We have different types of students that will join the course. You have some basic scientists that have a background in biomedical science, or for example, in genetics or others. We have some doctors and we have some midwives. Where do you go after the master? Some of our students went to do some reproductive science embryology STP. So STP, it's a program run by the NHS. It's a scientific training program. So you could do one in reproductive science embryology, or one in genomics, or one in genomic counseling. Some return to their clinical work. Other students go into doing research degrees, and they start, for example, a PhD. Some go into the industry where you can find a career in diagnostic. Some go and do a degree in medicine, and of course, others do other things. We have the Moodle page. We also have a Facebook page set up for all the students of the coming year. And once you have accepted your offer, usually from July, you will be given access to also our Facebook, but our welcome Moodle page. Moodle is a virtual learning platform that UCL uses to communicate with students. And it's a great idea to get familiar with how it works, of course. We send students some pre-reading to do over the summer, and this really helps you to understand by reading material that we send to introduce the topics you're going to learn, and especially because you may come from different backgrounds. So on this Moodle page, you will have all the information that is necessary for each of your modules. You will have your timetable, so an overview of your timetable, and then per week with all the information about each lectures. You will find slides in advance most of the time, as much as we can, and then recordings if we have some additional materials, and that's a way for us to communicate with you and send all the information. At UCL, there is a very strong student support and feedback in both directions, from us to you and from you to us. So there is the Director of Education, Suzy, and we have Maria as well. There is the Departmental Graduate Tutor, the Program Director, the one for this MSc, as you know. You will also all be attributed a personal tutor who will be there to support your studies whilst you're at UCL. You will have a supervisor who will supervise and support you for your project. You will have the education administrators who will liaise with you throughout the year for your lectures. You will be organized in peer groups. So all the students in your MSc will be allocated a subgroup, and that's what we call the peer group, where you can support each other throughout the year for your learning. We have at UCL a very strong well-being and support system. And finally, you have the UCL Union to support you. So we have the Academic Communication Center, ACC. ACC is here to support you with your academic communication throughout your studies. They work very closely with UCL academic departments and the faculties. They develop workshops, they have courses, they have tutorials, and you can attend all this. You can benefit from all this additional support and learning once you register at UCL, and you can use them to improve and enhance your writing, your speaking skills, your presentation skills, and make most of your time at UCL. It's really a service that complements your master. It offers academic writing courses in term 1 and 2, and in term 2 and 3 you have courses for how to write research projects and how to write dissertations. They are for all students. They help you to communicate critically, confidently at a postgraduate level, and they help you to understand what is really expected of you and in your assessments at that level. It's very important to say that it also offers you grammar for academic writing courses for all of you who do not have English language as the first tongue. And the courses start in October. They also have one-to-one tutorials that start in November, and these ones can be used to discuss structure and the language of your writing, or to help you prepare when you have a presentation to do. And I really strongly advise you to go on their website, where they have all this information and where you can register for all this additional support and training available when you register at UCL. You will have also more information in our institute. We use a lot of social media platforms. We have Twitter, we have Facebook, we have YouTube. And you can follow these platforms for interesting articles and updates on different programs. So you can find more on the website. Of course, you can email me or email the administration. And no, it's not March. Yeah, so your application deadline is March 2023. Okay. And that's our motto in our institute: better lives for women and children across the world. And that's the end of my presentation. So now I and Suzy and Alison, and we should have a student joining us, hopefully, can answer your questions if you have any about this fantastic program we are offering.
Yeah, feel free to, we don't have many of you on the line, so you're welcome to either turn your cameras on if you'd like or not, and just stick your metaphorical hand up and you can turn your mute off and we can hear from you. Or if you'd rather, you can put it in the chat. Either is fine. While you're thinking of questions before they come up, just a few things to say on top of what Pascale said. So the Institute, because we've got several different programs, it's really nice. You'll get to visit, you'll get to know both your cohort on this particular master's program, as well as different master's students. And students always find that really helpful. It's really nice to have the input of students with different backgrounds, with different academic experiences or working experiences, and you'll get to learn from them, and you'll have discussion groups in many of your modules that you share together. So I think that's a real strength of the programs in general across the Institute. We also offer a wide range of projects, like Pascale said. So although most of the students on this program are interested in lab-based projects, you don't have to be. If you're more interested in something perhaps more on the social sciences level or something clinical, then those projects are available to you too. So we don't restrict who takes what project, if you see what I mean, across the different programs.
Plus, there is a large range of offers when it comes to research projects, a large range of different supervisors and topics for research in the lab as well.
Yeah, the way the projects is done is that actually there's sort of several ways to find your own project. You can either come with an idea that you're interested in and speak to both Pascale and potential supervisors about, sort of turning that idea into an actual project. Or we also offer like a list of projects that are available that academics have sort of already got. Maybe they already have ethical approval for, maybe it's already part of a grant, for example, and they're happy to take on a master's student, so that there's that way. Or you can approach various different lecturers during your program, that you find interesting, and see if they have projects available. So there's a real variety of ways of students to get involved in research, to find something that, ideally a topic that they really love, but also the techniques that they may use, further on in their career, whether that be in the lab or elsewhere. So there's a big range.
I was wondering, Suzy and Pascale, the sort of careers that students go on to after the programme.
Yeah, there's a variety, like Pascale did mention, but then we do see students that go on to research. Quite a lot take up PhDs. Some of those can be related to their projects that they've done in the Institute. Obviously, that depends what funding is available from their supervisors. But also students go into, they're often taking time out from their clinical work, or they may be in allied health professionals, so they may work as midwives or something similar, and they will go back to their program with that. Across the Institute, we do have students that go into things like health policy, that have worked for charities, for NGOs. So there's a real, quite a broad spectrum. And within the Institute, we offer careers days that are specific to women's health throughout the whole year. So we'll have specific career sessions on a career in research, a clinical career, embryology. There's one on social sciences. And then there's sort of an out-of-the-box thinking one, which is, includes sort of like publishing and working for companies, etc. The things that you might not have considered. And of course, there's the UCL Careers Service, which is fantastic. And we always suggest that our students sign up with them and use those as a really valuable resource while they're here as well. So there's lots of guidance. If you come and you don't know what to do, what you want to do next, that's absolutely fine as well. You don't need to decide. And we will give you lots of support to make the next steps. Make the most of your masters as well. Any other questions? The only other thing I thought to mention, actually, because it's something that we get asked quite a lot, is about the sort of structure of the course. So as Pascale said, there are 8 taught modules, each of the modules for this program is sort of run on a 3-week block. So within that 3 weeks, you might have teaching on normally 3 or 4 days a week. Wednesdays are usually kept clear of teaching because those are where we offer our observation days, which I'll talk about a little bit. But so you'll have teaching face-to-face on most of those days for the 3 weeks, and then your assessment will either be, it'll be sometimes within those 3 weeks, but more often than not, it will be outside of those 3 weeks. So time management is really important sort of across the program, but we'll give you all those dates at the beginning of the year so you can sort of plan ahead, because I think that's really important. And of course, there's lots of ways that, you know, we all know that life happens for everybody, you know, so if things do happen outside of your control, there's lots of ways we can support you with assessments, you know, with delays to assessments if you need that, moving to part-time, for example, if you're a full-time student, or in some cases, you know, interrupting studies for a year might be necessary. And that's all something that we're happy to guide you through. And you'll talk through that with Pascale as your program director, or with myself as the director of education. If you're taking the course as a part-time student, how it works is you would still take the same modules, but you would just spread out those modules. So you would still need to be available sort of for a 3-week block, if you like. Otherwise, we'd have to run each of the modules in various different ways. So it's not ideal, but it does. Some of our students find it really helpful. They can take sort of annual leave from their job for 3 weeks to do a module, or they might, you know, really reduce their shifts if they're working clinically, for example. And then in terms of the observation days, we do offer observation of various clinics as part of some of the modules that you're taking. Obviously that was paused over COVID, but it's back up and running again now, which is really, really good to see. And the students get a lot out of that. So you can go and visit the fetal medicine unit, the reproductive medicine unit, and one of the IVF clinics that we have contacts with. So that's a really good opportunity for all of our students across the programs, actually.
Maybe I can ask also the add as well that so the course in itself is 180 credits to see a bit how it splits. So we start with the introduction week, with the skills week, and after that we start the modules, 8 modules, and each module will give you 50 credits. So you have 15 times 8, that gives you 120 credits. And for each module, you have lectures, you have seminars, tutorials, these type of things. And then from mid-June to early September, you have no more modules, but you do the project, which in itself is 60 credits, right? So the 120 credits of your modules add up to the 60 credits of your project, and that gives you the 180 credits of the whole MSc.
Yeah, we ask students we start talking to students about their projects from the beginning, really, from the induction week and the skills week, and we guide students to make a decision about sort of a very rough title and their project supervisor by the sort of end of the first term. So then in the second term, you can be, you know, in your spare time, you can be doing, background reading. You may make some visits to the lab, but you normally won't start full-time project work, like Pascale said, until your taught modules are finished in June. And then you have the summer to, you know, undertake the project, write up all the results, etc. And then submit at the very end of August, beginning of September.
Do you have any questions?
There's a question in the chat. Are there any funding options to cover the full tuition fee for the masters? So the funding is always tricky. There are funding opportunities that you can search for on the UCL website. I will look for the link in a second, and you can search for women's health, and it will give you if there are any funds available. Sorry, Pascale, go on.
No, Alison just sent the link.
Yes, I've just uploaded the scholarship finder that I think is quite helpful. Amisha, you'll be able to put in the course you're interested in, and it will bring up all the scholarships you'd be eligible for, including specific ones to the Institute for Women's Health, but also UCL widely.
Yeah. but funding is often a worry for students. I understand that their fees are expensive, and especially at the moment, cost of living, etc. So it's something to consider. Any other questions, areas that you're interested in? In that case, I think we've covered everything. Like Pascale said, you're welcome to email Pascale or the admin team. They will pass that on if you have any further questions. Alison, anything else you'd like to add before we wrap up?
No, just that I will put that I'll put the link to the prospectus and also the link to the email for the admin team as well. I'll put that in the chat.
And I can see there's a question about more information about admission requirements. Yeah, our admission requirements are the same, pretty much the same across all of our programs. So you need to have a 2-1 equivalent in a bachelor's degree in a science related subject. So for this program, we have people that have done medicine, like biological sciences, biology, genetics, things of that nature. If you're not sure whether your degree fits the bill, then please do email the admin team, and we can have a look at that specifically. And then you also need to have what's called a good standard of English. So if your degree was not taught in English, then you'll need to demonstrate that by using one of the standard English tests. Again, UCL has all that information available on their admission pages about which tests and what marks you need for which tests, for example. We then review those applications and then we'll start giving out offers round about now, actually. So we'll start to look at giving out offers from the new year, and then the program closes at the end of March, or the admissions closes in the end of March. If we're not full, we will keep the program open, so that is a possibility, but I would strongly suggest, if you're interested, that you get your applications in before the end of March. If there's any problems with the admissions process, any questions that you have, please feel free to ask us, because of course everyone's different. It's nice if students have work experience in this area, but it's absolutely not essential. So if you have any questions, yeah, just let us know. Oh, thanks, Alison. Yeah. Great. If there's nothing else, it's weird. I can't see whether you're typing. So if someone's typing something, you don't know if to wait for them. But I'm guessing they're not. In which case, thank you very much for coming. Thank you very much for listening. And we hope to hear from you soon.
Thanks so much, everyone. Have a good rest of the day. Thanks, Pascale. Thanks, Suzy.
Bye.
Bye.